Good morning, everyone, and you're very welcome to today, the first annual Lived Experience Awareness launch. So we're delighted to welcome you all here today in the room and online. To begin proceedings, it is my great pleasure to introduce the Government Chief Whip and Minister for Mental Health, Mary Butler. Minister Butler has been a champion for mental health and wellbeing in Ireland since she took responsibility for the mental health brief in 2020. Since then, she has been instrumental not just in progressing the delivery of mental health policy, but also in embedding lived experience expertise and the voice of lived experience in policy design, development, delivery and oversight. Minister Butler has also committed to supporting implementation with an appropriate legislative environment through the enactment of the new mental health bill, so the delivery of which I know is a priority both for her and for her government colleagues in 2025. Under Minister Butler's leadership, we have seen successive record budgets for mental health to support the implementation of these policies. This trend continued in Budget 2026, with last week's announcement of over 1.55 billion euros budgeted for mental health services for next year, a record funding level and an increase for the 6th year in a row. In total, mental health funding has increased by over 51% since 2020, when Minister Butler was first appointed. I'm sure Minister Butler will give you a sense in her address today of the progress we have achieved to date in promoting positive mental health in all levels of society and delivering a human rights-based and focused, patient-centred and recovery-oriented supports for the entire population. As many of you are aware, Minister Butler led the establishment of strong governance structures to support the delivery of Sharing the Vision through the National Implementation and Monitoring Committee, or NIMC, which has been central in driving and overseeing the long-term implementation of our policy. She has been dedicated to the inclusion of the voices of those with lived and living experience in all aspects of policy design, implementation and service delivery, advocating for the vital role of the reference group and the support for Sharing the Vision itself in recruiting a lived experience member of the NIMC Steering Committee to add value and lived expertise to that vital implementation structure. Today is a reflection of Minister Butler's commitment to lived experience as a key and fundamental part of policy making and service delivery, not just in mental health, but across the range of services, initiatives and supports the government, public service and our partner organisations are responsible for providing. It is vital that lived experience informs, enriches and influences all of the work we do, and the programme for today speaks very clearly of that. So it's an honour today to have Minister Butler address us, and without further ado, I want to thank you for your attendance and welcome Minister Butler.
Good morning everybody, and thank you Siobhan for those very, very kind words. My head won't go out the door, but I guarantee it will have to go out the door because I have a busy day ahead, combining my role as Chief Whip of the Government and as Minister for Mental Health. Today is a really important day as we mark the first annual National Lived Experience Awareness Day. We honour the truth that lived experience is not just valuable, it is vital to shaping better public policy and delivering services that truly meet people's needs. After all, those who walk the path know it best. And I think those words just sum it all up. Those who walk the path know it best. And it's hard to credit that in 2025, we're in a situation where we have a whole section in the Department of Health that is dedicated to lived experience, recovery and education. And I think we're an outlier in Europe because of that reason. It doesn't happen very often. And that the lived experience of so many of us are shaping our mental health policy as we go forward. Every day of the week, I suppose one of the things that drives me on is the voice and choice, whether it's older people, whether it's people with disability, whether it's people with emotional distress, enduring mental health conditions, whether I'm a TD in the constituency of Waterford, or whether I'm the Chief Whip, or whether I'm the Minister for Mental Health, 3 busy roles. But every day I focus on the voice and choice of people, listening to constituents, making sure their voices are heard and learning from it, because it's so important that we listen. I'm delighted to be joined by my colleague, Deputy Eamon Scanlon, here this morning. Thanks, Eamon, for taking the time. I know there's a lot of things going on in the house across at the moment, both in the Dáil and the Shannon, and a lot of people have sent their apologies. But I think, again, we'll go back to focusing on those who walk the path know it best. This is a landmark moment. I really do believe this is a landmark moment when we can celebrate Lived Experience Awareness Day. And when we talk about lived experience, I think it's really important that we talk about living experience. So we have the lived experience of people have what they have gone through. But everyone here in this room today has a living experience. We're living through different things. And I suppose I had a moment myself in my own family last week where we had the lived experience of psychiatry a later life, coming to meet my mother last Friday morning for an hour, and a nurse with her. And just from a perspective of tweaking medication and anxiety and a little bit of depression. And to be able to say that we had a community team that would come to my mother's house, not because I was Minister for Mental Health, because I left my sisters deal with it, because there's a conflict of interest, but to think or imagine that a team would come to the house for 1 hour to tweak a person's medication at 88 years of age, and that the community nurse was present, and the community nurse said, I'll be back again in 2 weeks' time. There's my phone number, and whatever you need, we will do. For me, that makes every day worth getting up in the morning. That makes it worthwhile having secured almost 1.6 billion in mental health funding in this year's budget. That makes it worthwhile for the 300 additional staff we will hire next year. That makes it worthwhile for the 40 staff that were secured to go into the emergency departments, the level 4 emergency departments, clinical nurse specialists, advanced nurse practitioners that will go in to the emergency department out of hours to support the NCHD. That's a game changer. That is, I think, one of the most important things I have done in 6 budgets. It was interesting when I went into the room to negotiate the budget. I was the only person in the room that had been there for 6 years in a row, regardless of who was sitting across from me and who was sitting on my side. First time ever, I think, that any minister would have delivered 6 budgets in a row. And please God, I'll deliver number 7 and I'll deliver number 8. I know I'm in the job for 3 years anyway, which is really important. But an awful lot of the work in relation to what you do in budget started at the end of July when the Dáil went into recess, and I started all the meetings with the various organisations, the various NGOs, the executive clinical directors, the clinical leads, my team in the Department of Health and the HSE, and my own lived experience of what I come across every day of the week. And that's how a budget is determined. And there was a lot of drafts. There was first drafts and second drafts and third drafts. But I suppose you have to go through a budget to understand what it's like. So when I went up to the minister's office last Monday week, I think, is it last Monday? Last Monday week, yeah. I went in the door with 217 whole-time equivalents. I came out the door with 300 an hour later. So that's what negotiations are all about. And, you know, it's a fantastic budget, 83 million in additional funding, 300 posts. And every single post makes a difference, you know, and the geographical spread. I fight very hard for the budget, working with a fantastic team. But I also follow through the budget every single month. So currently we're still following the 2025 budget. The meetings go on every single week, every single month that we follow the 2025 budget. We won't follow the 26 budget until next year, but it's really important that we do that. I suppose I better go back to the script or nobody will be thanked. When we talk about lived experience, we talk about being seen, being heard and respected. And the principle is at the heart of Sláinte Care, our national framework for delivering the right care in the right place at the right time. And to achieve that, we must listen to those who know the system best, the people who use it. Lived experience is not an abstract concept. It's the daily reality of navigating services, overcoming challenges and finding paths to recovery. It is the voice of people at the centre of their own care. Today, we will hear directly from lived experience leaders who embody this expertise. Thank you for your courage, for your insight, and your commitment to improving care for others. The inclusion of lived and living experience is a clear policy and a clear priority for this government, and I was delighted to be able to write it in clearly into the programme for government. It's embedded across our key strategies from Sláinte Care to the National Human Rights Strategy for People with Disabilities, sharing the vision, the Traveller Health Action Plan and the forthcoming Mental Health Act. And I'm making sure lived experience is central to the development of all mental health policies. The recent public consultation on the forthcoming successor suicide reduction strategy had almost 1,900 submissions, with a further 200 people attending in-person workshops to ensure their voices are heard in the new policy. And when you put that into perspective, that's a huge amount of people who are interested in our mental health policies. In addition, my department has established a dedicated lived experience reference group to play an integral role in the drafting and finalisation of the strategy. Separately, government is regulating community CAMs through the Mental Health Bill to enhance service quality, and I was delighted to see that the Mental Health Commission went out to public consultation on that yesterday. So very, very timely. I really welcome this consultation because it's a chance for people with the lived experience to shape the new CAM standards. Their voices and their parents' voices are essential to improving services. Wait till I see I get the good bits. In 2024, we took a step forward by appointing a lived experience representative to the NIMIC committee, and I'm delighted that Catherine Brogan is here today. There she's sitting in front of me, ensuring that the voices of those with direct experience are heard at the highest level. This commitment is being further translated into action across the HSE through the Patient and Service User Engagement Office, the Office of Mental Health Engagement and Recovery, the Social Inclusion Office and others. These teams are leading the way in embedding lived experience through peer support roles, recovery education and inclusive policy delivery. Last week, I was pleased to announce an additional €500,000 in Budget 2025 for the Office of Mental Health Engagement and Recovery. This funding will expand Discovery College education for children and young people nationwide and increase the number of peer support workers across our health regions. Discovery colleges work so well because we're using premises we already have. We're using the supports we already have in the community. When I think of the one up in Roscommon, in Castlereagh, that particular area. And I was really struck that time because you had the school, you had the library, you had the CAMS teams, you had the Parents' Council, you had Corlin and Oak, you had everyone pulling together for this Discovery College. And they're quite inexpensive to deliver. All you want are people pulling together to get it over the line, and all those services are there, and just having the joined up thinking. We are also expanding crisis resolution services in Donegal, Kerry and the Midlands, including lived experience-led solace cafes, which offer compassion, community-based support. The focus on next year's budget was in relation to crisis response and, crisis response in relation to suicide ideation as well. And I was really struck by an email I received after the budget. So when I was up in Donegal at the end of August, I spent a whole day up there and I met the three CAMS teams. The clinical director from the Department of Psychiatry came along as well. All those working in CAMS. But 3 GPs left their practices that day to come and visit me, to come and meet me, to come and talk to me. I spent the whole day up there. And I was so struck by the way Donegal is a kind of, I won't say it's an outlier, but geographically it's an outlier, and they're a long way from services in Dublin or Galway. And the way they all pulled together, it was something to behold. Wasn't captured, I have to say, in the CAMS review that was done previously by either the HSE or the Mental Health Commission. It wasn't captured the way this area just pulled together. They have their own dedicated, Dermot Monaghan, their own dedicated IHA manager. So one manager for that area was a really brilliant idea, and I congratulated Tony Canavan on that. But one of the consultants I met, he's from South Africa. He comes to Ireland for 7 or 8 months of the year. So he contacted me last Wednesday night. I had been on Highland Radio speaking about the new crisis resolution team in Donegal. And he contacted me to say that the visit and the fact that I spent the whole day up there with all the various mental health teams and listened, and then turned around and working with all the people in the HSE, the department, and obviously the government to secure the funding, to be able to have listened, to know that what they were really lacking was because they're Letterkenny Model 3 Hospital, I think, and they didn't have, that crisis response out of hours. And the fact now they'll have the crisis resolution team, they'll have the Solace Cafe, it was just the final piece of the jigsaw for them. And for this consultant psychiatrist who had promised me that day that there was 10 young people waiting over 12 months, and that he would take those 10 people waiting over 12 months off the waiting list before he went back to South Africa. He comes every year for about 8 months to Donegal and works. And he took the 10 children off the waiting list. It was interesting to note that all of the 10 of them had an ADHD diagnosis. 5 of them did not need to be medicated. One needed a lot of additional supports, and the other 4 were referred back to their GP. And to see that type of joined up thinking, because one particular team was overrun, they had a lot of people waiting. But they only had 10 over 12 months. And he said, he held up his hand and he said, I'll take those 10 off before I go back. And he did. Emailed me to say, thank you very much for coming, thank you for delivering, but most importantly, thank you for listening to the lived experience of us working every day of the week. So that's another side to lived experience, listening to the consultants. Today, over 430 lived experience practitioners are working across the HSE, the housing sector, and in our community and voluntary sector. And as a result, Ireland's leadership in this area is being recognised globally. The World Health Organization recently published Transforming Mental Health Through Lived Experience, a global roadmap for integrated living and living experience practitioners into policy and services. I'm so proud that Ireland's own HSE Office of Mental Health, Engagement and Recovery, under the leadership of Michael Ryan, was the lead author of this agenda-setting publication. Congratulations, Michael, and I believe you deserve a really big bullabus. Similarly, I was honoured to represent Ireland at a high-level World Health Organization meeting in Paris in June, where 33 countries gathered to assert the importance of including mental health in all policies. Ireland were already doing that, and we were held up as an exemplar at that conference. We're not always held up as an exemplar in relation to mental health in our own country, but we are certainly all trying to make a difference day by day. Crucially, the declaration referred to the need for people with lived experience and their families to be included from the outset and through a co-creative approach in the design, implementation and monitoring of public policies. This approach is already reflected here at home through the Strengthening Lived Experience programme, a collaboration between the HSE, the Housing Agency and Genio, which is building momentum across Ireland. And what a lot of people don't realise, that in 2024, 500 people with enduring mental health conditions were supported through the HSE and the Housing Agency to have their own forever home. 500 people with enduring mental health conditions were supported last year. You won't ever see that headline, but that is a really good headline, that 500 people. And it was interesting when I was out in Rome that I met with the Minister for Health from Malta, and they're only at a situation now where they're starting to decongregate. They're only starting in Malta on that. They're really good in other areas, really good in relation to trans healthcare, in different things. So it's not that they're a conservative country per se, but the fact is that they're only starting to decongregate, and he wanted to sit down with me to know how did Ireland manage decongregation and how can you get people in their own communities accepting that a neighbour who is living beside them might have enduring mental health conditions. With the correct supports, they can live. And I was explaining to him how we have done it over very many years, well before my time as minister, and how well it has worked. So we are a country that people look to see how we deliver mental health supports, especially including lived experience and peer support. So to everyone involved in this work, genuinely thank you. Your efforts are transforming services. You're making them more person-centred, more responsive to people's needs, and thus more effective. I especially want to thank those who are sharing their stories today. Robbie Maguire, Chloe Costello, Paul Clabby, Maggie McDonough, and Michael Sifu. Your voices are powerful and your contributions are deeply appreciated. Thank you also to the many supporters of this work, Joe Ryan, Lola Elaine, Paul Alford, Brian Higgins, and Lived Experience Advisory Board members Jennifer Harrow Sheepa. I'm so grateful to Michael Ryan and Jessica Curtis for their expertise and passion for promoting expertise by experience and your vision in setting up this wonderful event. To my colleagues in the Oireachtas, Aisling, thank you much for being here, Deputy Aisling Dempsey. I hope today's conversations inspire you to continue championing the inclusion of lived experience in your own areas of work. And as I conclude, let us return to where it all began. Those who walk the path know it best. If we are to build a health and social care system that truly serves its people, we must continue to live to listen to, and crucially learn from those who live it every day. Their experience is not just a story, it is a guide. And with this genuine inclusion of their insight, we can build a system that is not only more compassionate, but more effective, more just, and more human. So from the bottom of my heart, I just want to thank everyone for the work that they have done today. It really is invaluable that living experience is embedded in our mental health services. And as I finish every speech with, there is no health without mental health. Gorv míle maith agus go léir.
Good morning, everybody. My name is Michael Ryan, and I'm from the Office of Mental Health Engagement and Recovery. And as Minister said, it is a monumental day today. It's a landmark day. It's an absolute pleasure and privilege for me to be here. And it's something that we couldn't have celebrated 5 or 10 years ago, but we can today. And today isn't about any particular organisation, person or group. You know, it's about something much more powerful than that, something much more important. It's about the lived experience of ordinary people using our services. But I do think in fairness, it would be remiss not to acknowledge the work you've done, Minister, in the last 6 years to promote lived experience, particularly in mental health. And we're extremely grateful for that. And we were delighted when you were reappointed as Minister for Health, and you got the additional portfolio of Chief Whip as well. And I'm not one who's particularly au fait with the runnings of government, so I had to look up and see what exactly that meant. And I suppose in my simpleton understanding of it, it's you know, your job is to make sure that the programme of government is delivered and that the function of government is done efficiently. And really, that's ensuring that the voice of the people, you know, is demonstrated and in the work of government. You know, so I think it's very fitting in that concept that you're here today talking about lived experience, ensuring that the voice of people, you know, is at the heart of our services in health, in social care, in housing. And when we talk about lived experience, what we're talking about in that concept is it's about people who have lived or are living, as you say, with a condition or in a certain situation. It's about what that was like for them, how they progressed with their lives and what they've achieved, and how that form of expertise, that form of knowledge can help other systems and other people. That's what this is about when we talk about lived experience expertise. And today we're going to hear a lot of examples, you know, of the really good work that lived experience does and people with lived experience do. But I think it's also important today to acknowledge that for some people, their lived or living experience, their voice, you know, they never got the opportunity that maybe others did. And lived experience comes from a place of difficulty. It comes from a place of adversity. It comes from a place of unwellness. It comes from a place maybe of fear, of stigma. And for some people, you know, they never got the opportunity to progress beyond that. So we acknowledge all those people today as well. But their story isn't lost. It's part of this. Their lived experience, you know, is the part of the lived experience we bring forward. And today, there's people like me speaking about it here. But we're only here because we got the opportunity to engage with our lived experience, to develop and to become the people we could become. And it's not that we're great, it's that we stand on the shoulders, you know, of giants who were greater, you know, those people maybe that didn't get to articulate their voice in the same way. So we do acknowledge those today. And as I said, you know, I am a person of lived experience. My story is It relates to mental health challenges and addiction. And for a number of years in my life, that had a very powerful impact. It involved a number of hospitalizations, some lengthy. It involved periods of homelessness. It involved complete breakdown in my ability to live what we'd call a normal life. Loss of relationship with family and community. Suicidal ideation was a part of my life. I'd lost the hope to continue on. But something happened. Obviously, today I'm in a place of recovery. Today I can say I'm recovered, but I'm not cured. I'm not in a place of perfect mental health. And that came about through the intervention of lived experience. A peer supporter came to me and talked in a way I could understand, and set me on the journey to recovery. I was able to engage better with services then. I was able to reconnect with natural support, and I was able to start to achieve my potential as a person. And I became involved in advocacy as a volunteer. I became involved in service improvement initiatives in my local service. And I began to learn that actually my lived experience has value. It can help others. It can help change the system. I went on then to become a lived experience practitioner. I became a peer support worker. Then I became a recovery lead. And today, I suppose I've moved on to be head of the Office of Mental Health Engagement and Recovery. I'm sit as part of Brian's team there. And my job is to bring the perspective of lived experience to the design, the development, the delivery of mental health services. And we do that through a range of programs, peer support working. Thank you for the new post, Minister. Recovery education. Engagement to inform service improvement. Policy implementation. The Office of Mental Health Engagement leads on the implementation of 11 sharing division recommendations. Something like that has never happened before because it was believed that people with lived experience need to be the people delivering in these particular areas. I've also had the privilege, as Minister referenced there, to represent and talk about lived experience internationally with the World Health Organization, with a special advisor to the Global Leadership Exchange. I could never have envisaged anything like that. There was a time in my life I was hospitalized, I was isolated. I isolated myself in my own bedroom, locked away. The idea that I would stand anywhere and speak to people about my lived experience, was beyond comprehension. But that's the power of recovery and what it can do, in the same way that lived experience, unresolved challenges around mental health and addiction, had a very severe impact on my life. Recovery had a very transformative one, and I became the person I can be, hopefully. But that's just my story. But there are many stories, and we'll hear more examples of them today. And we will end, with a call to action. That we continue to promote and develop lived experience. And what is it that lived experience brings? It's about, the question we need to ask is, what has happened to the person, not what is wrong with them. Lived experience is a source of strength. It's a beacon of hope. It's a source of inspiration. It enables rights. It breaks stigma. And above all, it changes lives and improves services. And this is what Lived Experience Awareness Day is about. It's ensuring that expertise and that concept informs everything we do in healthcare, in social care, in housing, in any areas of our work. Thank you for listening.
My name is Chloe Costello and I am peer recovery educator of Discovery College West. Recognising lived experience is important because it's more than just a perspective, it's a powerful form of knowledge, and it comes from people that have walked through the system and they've felt the gaps, they've experienced the challenges, and they know what it is that works really well. And when you truly start to listen to those voices, you start looking at the system in a different way. So you stop looking at it through policies and procedures, and instead you look at it through the eyes of those that are affected by them. Recognising lived experience, it honours the real stories of people, and it acknowledges that they hold valuable insight that no textbook or degree could ever teach. When you invite the lived experience around the table, you're not just asking them to share their stories, they get to shape the solutions. And from that, you create services that are so much more compassionate and empowering and empathic. We really just empower communities, and most importantly, instead of doing things to people, you start to do things with them.
Hi, I'm Maggie McDonough. I am Primary Healthcare Coordinator in Balbriggan Travellers Project. Balbriggan Travellers Primary Healthcare Project is based in North Fingal. We work with travellers throughout the Fingal area to signpost them to services, to create relationships with the service providers to try to bridge the gaps of travellers accessing the services. As an Irish traveller, I want to use my experience of resilience, identity and overcoming barriers to support other travellers in their journey. I know what it feels like to face stigma and exclusion, and I want to ensure voices from the community are heard and valued. My story can help bridge understanding between services and the traveller community, making supports more accessible and respectful. So I use my lived experience to develop cultural awareness training for services like TUSA, HSE, schools, nurses, and this is to go towards, I suppose, helping people who are working within these services to support travellers. They may not know anything about travellers, only what they've heard, haven't actually experienced it, but also to, I suppose, show them the reality of travellers' lives, to understand the issues the travellers are facing and what they can't overcome because there's too many pressures in place, too many barriers in place. Show them that an awful lot of travellers live in isolated areas with no public transport. So if they are missing appointments, it could really be down to the lack of transport. It could be that they're too far away to be able to engage, or it could be the fear of services because they might have had prior engagement with services and it could have been negative, so it's kind of scared them away a little bit. So it's, I suppose, building their capacity to be able to work with travellers, so when a traveller does access support, that they're more capable of working with that individual.
So over the years working as a peer support worker, I've been in MDT meetings, and coming in with lived experience, sometimes I felt inadequate as well, because you're with people that maybe have gone to further education and heads of services and things like that, and I was asked for my opinion on certain cases, and the lived experience I was able to come from the participant's point of view. Sometimes there was goals or targets set which were quite they were realistic for some people, but for the type of vulnerable people we were working with in the homeless section, they were unrealistic. And from my experience then, I was able to say, look, can we break this down a bit, or or maybe this person, like, this is enough for them, that we don't have to push these expectations on the participants. And I would then go and sit with the participant and explain, look, this is after being suggested, how do you feel about linking in with this service, or going here or going there, and I'd talk them through it, and then I'd bring them along and I'd go to the appointment with them, and the initial assessment, and do all that. And that was only from me sharing my lived experience with them. And where I'm at now today, I'm working as a youth worker in the area where I grew up, and the young people that I work with are harder to reach. It's youth diversion work, and again, my lived experience You know, I've grown up in a block of flats and there's criminality and there's not much money and there's all this stuff. So, you know, I can share little bits about my story and the young people are relating and, you know, it builds a relationship. And that's what you get with lived experience. You can't learn this stuff from a book, you know. I've been through all these different things and I share my experience and then I encourage the people that I'm working with, and my past can help someone else's future.
I chose to work in a lived experience role because from my own personal experience, when I was struggling with my mental health issues, when I felt that I didn't have any hope, when I felt disconnected from society, I received a unique type of help. And that type of help is called peer support, where people also with their own lived experience of mental health challenges support each other. And it's their wisdom that they have in their recovery that can be used to help other people. It certainly helped me, and it helped me get on the journey of recovery where step by step I started to re-engage more with my community. I started to take on more meaningful roles, and I feel that the place where lived experience and peer support is needed the most is in the mental health services, where many of the people in our society are the most marginalised, most disconnected. They feel that there is no hope for them. They feel that they might be linked with the services forever. And I think it's very important to have people employed in the mental health services who can offer that hope that I received from others, so that they can feel more hopeful about the future, more hopeful that they can look forward to tomorrow, next week, next month, next year, with true hope.
Well, we've had a peer support worker on our team since 2017, so we've a lot of experience of working with peer support workers, and it's invaluable. Our peer support worker engages with people who generally would have traditionally had a lot of difficulty engaging in clinical areas, and we've had a lot of success with good engagement using peer support work and the model. Often it won't be in a clinical setting, it'll be outside of core clinical settings, a little bit more time, a little bit more relaxed, green spaces, walking in wooded areas, walking and talking. And sometimes not an awful lot of talking is done. It's being present with somebody, being with somebody down by some water in a blue space, and that feels very unthreatening and very safe. And yet there's work being done, that level of engagement to be done. And that's what's happening. We're seeing this then as we're going through the iterations of care planning, recovery planning, and had success with people moving from rehab recovery. And yeah, the therapeutic relationship is forming at a different level with peer support work. But the peer support worker attends our team meeting every week. And the lived experience, I think, gives us room to pause sometimes as clinicians. Certainly when we hit a clinical conundrum, sometimes the perspective of that lived experience is very important. So we find that very helpful in my team and in other teams that I've just got to interface with as well of peer support work in our area.
My name is Michael Saifu. I'm a physically disabled person. I am a full-time wheelchair user. I have been involved in disability activism for several years now, and I'm currently working as a policy officer at Independent Living Movement Ireland, which is a disabled persons organization. One way I used my lived experience perspective to help improve a service or a system was by encouraging others learn from my experience on what works and what does not work. To me, the real test for the success or otherwise of a system is the extent to which it manages or it matches with the needs of service users or people which is the system was meant to serve in the first place. So I use my lived experience to dissuade service providers and policymakers from second guessing what disabled people want, instead of making disabled people an integral part of the whole process. Well, I chose to work in a lived experience role because there is a lot I can share from my own experience to make services and policies better. That's one reason. Another reason is I use it to encourage other disabled people to be aware of their rights and also appreciate the values of having a collective voice. lived experience brings a unique value in terms of improving the user focus of services, and it also encourages a sense of ownership by those affected most, like disabled people. Disability is first and foremost a lived experience. People could have some knowledge about disability by reading books or take college courses or having a disabled family member. But all this in no way can grasp what disability is as much as we disabled people who live it 24/7. If service providers and policymakers want to make real and positive changes to the lives of disabled people, I believe their first port of call should be disabled people themselves, having their lived experience in decision making from the start.
Good morning, everybody. My name is Yolo Elian, and I'm the Assistant National Director for Patient and Service User Experience. My own lived experience journey started as an 8-year-old in a rural community in North Wales. My mother was an OT, and she wanted children of all abilities to grow up side by side and aware of their own differences. She wanted people to have a voice. We now know this as a lived experience voice. She set up a club called FAB, Physically Handicapped and Able Body. Children in our community attended this Friday night club and grew up embracing all abilities. This early intervention, of course, brought me to social work, and for the next 25 years, bringing the voice of people to the front has been my passion. Today, I'm privileged to be in a position to lead on this change towards partnership for the HSE, moving from consultation to engagement and through to true partnership under the leadership of Bernard Gloucester and Joe Ryan is an honour for me. We've taken huge steps during the last 3 years in partnership with the National Patients and Service User Forum. In 2023, during the design of the health regions, our patients and service user partners had identified 3 priorities. The first priority was they wanted to recruit 6 regional patients and service user leads, which we now have in post since August. 1 national lead, which is coming to post on the 17th of November. And more importantly, they wanted a governance structure, which included 6 regional councils and 1 national council. Our first regional council has been set up in the Midwest and has already been working to make changes. In 2026, we will launch our partnership strategy, which is a combination of 3 years' work. We're also about to launch our first phase of partnership training within a portal where staff and members of the public will be able to access training together. In September this year, we held our 3rd National Partnership Conference, co-designed and led by our partners from the Patients and Service User Forum. Today, I'd like to announce that in 2026, our intention is to hold the conference on the National Lived Experience Day to align these important dates. My 82-year-old mother was over last week for my daughter's 18th birthday. And she said to me, "How's work going, Yolo?" I said, "No, it's good, it's good." "Are we there yet, Yolo? Do you remember the days?" "No, Mum," I said, "we're on a journey and we're not quite there yet." Thank you. And I'll pass you to Roshan. Go on.
I'm going to go off script myself for a minute and say what a wonderful morning and session it's been so far. It's just been really inspirational. And you never stop learning, do you? And I'm hearing more about all the work that's going on, and it's fantastic. So congratulations to everybody. But it really is a privilege to be able to speak to you this morning on the inaugural National Lived Experience Awareness Day, and to share a few reflections on the work of the Sharing the Vision reference group that Minister Butler mentioned earlier when she spoke. As independent chair of the reference group, I have the really good fortune to work with an extraordinary group of people. and they bring a really wide range of lived experience, perspective, and that makes a unique expertise that's essential for shaping equitable, effective mental health policy and implementation. The reference group is hosted by Shine and was established in 2021 to ensure that these voices are at the heart of implementing Ireland's national mental health policy. And our role is to provide independent oversight, advice, and constructive challenge to the National Implementation Monitoring Group, its subgroups for sharing the vision. We're now in our second 3-year term, and the group continues with its work thanks to the dedication and the commitment of our members and their collaboration with the stakeholders throughout the Sharing the Vision implementation framework and network. Openness, honesty, and the determination to make the system better for others has really been behind its success. The approach and the process has been developed from the ground up, and there's immense learning in that. It's evolved steadily since the group was first established, and a strong and structured framework that recognises that real and lasting impact can only come when change is informed by the people who use the services and supports for the collective benefit of many. Through the work of the reference group, we've already seen real impact in improving the accessibility and the inclusiveness of mental health policy and communications, to encouraging the use of clearer person-centred language, approaches and perspectives. And very importantly, I think, is helping to break down the barriers of knowledge that often separate systems from the people that they serve. Each of these changes really represents a step towards a more responsive and compassionate system. The reference group really is now something unique in the Irish policy landscape. It's a sustainable and a practical model of partnership that can inform how other departments, organisations and agencies can embed lived experience into their own policy and implementation networks. So as I said, there's great transferable knowledge and learning in this, and the mental health sector in Ireland really has been a leader in this. And it's through the courage and the generosity of our members in sharing their time, their expertise, that open collaboration I mentioned with partners across the National Implementation and Monitoring Committee, the Department of Health, the HSE and Shine, and indeed the recognition that Minister Butler herself has placed on embedding lived experience in decision making is not just good practice, but it really is central to improving mental health and social services and to achieving meaningful and lasting change. Now, I'm really delighted to invite Fiona McGarry, a member of our reference group, to speak to you now, and she's going to talk about her experience of her work with the group. Thank you.
Thanks, Roisin. My name is Fiona McGarry and I have volunteered with the reference group to the National Implementation and Monitoring Committee for Sharing the Vision since its formation. I also speak as someone with lived experience personally and professionally of Ireland's mental health system and as an advocate for a more compassionate and person-centred approach to care. It has been a great honour to be a part of the reference group. I have met and learned from so many extraordinary people from all over the country whose wealth of experience, insights, expertise and knowledge have helped shape and support the implementation of Sharing the Vision. It's very motivating and inspiring to work alongside them. I would like to acknowledge the dedication and passion of previous reference group members who have completed their term, our former chairperson Sharon Lane, and the tireless work of Estella Vidal and Nicola Byrne from Shine, who facilitate and support the work of the group alongside Roisin Clark. We give them a bullabus. So what's it like being involved in the reference group? Well, there is a lot of paperwork, a lot of emails, reading reports, providing feedback, events and opportunities to work with subcommittees. The role has expanded a lot since its formation. It's a big commitment, and I should highlight that everybody gives their time voluntarily. Many of us have directly experienced the harms, there they are, that can be caused by a lack of access to timely support and the frustrations trying to navigate routes to appropriate care
for those we love and ourselves. We do all this because we believe that we can do better as a society for each other. We are passionate about giving a voice to those who are too often disenfranchised, stigmatised and unheard. Lived experience is essential to systems change and service improvement. It ensures that reform is grounded in reality, not theory, that policies are designed with people, not for them, and that services become more responsive, inclusive and effective. As the saying goes, nothing for us without us. It's a form of expertise distinct from, but equal to professional and clinical knowledge, because it reflects how our systems truly function for those they are meant to serve. I believe that Ireland would benefit from the development of a national lived experience policy, one that defines, resources, and supports meaningful participation across all levels of policy, planning, and delivery. This would also help standardise and strengthen lived experience roles, such as peer support workers, family peer workers, and lived experience educators, roles that bring hope, bridge trust, and model recovery. These roles must be properly trained, supported, and remunerated to be sustainable. In closing, sharing the vision offers a powerful blueprint for transformation, with clear accountability, sustained investment, and a formal policy on lived experience. Ireland can build a mental health system that truly listens, learns, and heals. Thank you.
Thanks, everybody. I'm just really moved by what we've just heard and what we've just seen. So yeah, I was going to say what a morning, and I think I'm really glad that I can say that. What a morning we've had, from Siobhan opening so generously and speaking to lived experience, to Minister Butler's ongoing powerful commitment to lived experience across the government, not just in mental health services, through to Michael Ryan sharing with us what it looks like to be a leader in services, a leader with lived experience in services, who's now getting international recognition, which is recognition for our country, our services, and also kind of tells us, let's step up to the mark, let's prove that we can do this, and we'll continue to do this across all sectors where we are supporting underserved communities. And thank you also to everybody who took part in the video, from Leona, Paul, Robbie, Maggie, Michael and Chloe. They each shared a different story, but particularly showed in the lived experience workforce how lived experience really can change systems, attitudes and lives. We've heard from Yolo about the public-patient partnership initiatives and the very exciting news that next year, on this day, we will all be hopefully working together, celebrating, recognising and promoting lived experience at their public-patient partnership conference. So thank you, Joe Ryan and Yolo Elian, for that commitment. Fiona and Roisin, thank you for sharing with us. I'm almost shaking a little bit from listening to Fiona speaking. Real truth to what it is we're aspiring to do here today. We're talking about doing this for real. Lived experience, roles, policies, standards and support. We want that to work for people across all of our health, social and housing services and beyond. So thank you, all of you. Thanks particularly to the contributors today, but I also want to say a quick thank you to the others who are behind the scenes supporting this work today. So thanks to Anya from Genio, thanks to Ellen from the HSC, thank you to Minister Butler's team, particularly to Ian and to Amy. Thank you to the Department of Health team, who you can imagine organising to get all of this scrambled together can be quite challenging. So thank you very much to Siobhan Hargis, to Joe, to Oisín and to Lisa. We really appreciate your support, and all, I'm sure there's lots of people beyond that. So I really want to say a special thank you as well for the commitment and collaboration of the Strengthening Lived Experience group, and particularly the Lived Experience Advisory group, who were behind us all the way, letting us know what it is we need to be doing properly and in co-production. Because when we work with people who have actually walked through every challenge and are in recovery or
en route to recovery or living with their challenges. We build services that are stronger, more just, as Fiona said, and as Roisin said, and more effective. Why not have effective services? It's common sense, and we know that this is an evidence-based way to do that work. Okay, so one more thing that I wanted to mention is, before the actual call to action, is that we have a training opportunity for anybody for whom lived experience is kind of a new concept or is a little bit fuzzy. We discovered an evidence-based lived experience training that is online for 1 hour. It's an Australian piece of training at the moment, but we are working at co-producing an Irish version of this training. But for now, just to have an introduction, there's a barcode on the information sheet on your chair. You can just scan that, and it's a free 1 hour training just to give yourself a little bit of an introduction. And for those who are watching on a web stream, we will also offer that to you. We'll share the barcode with you on the MHER website and on the LinkedIn for Genio and MHER. So we hope you have an opportunity to give that a shot if you haven't previously spent some time thinking about lived experience expertise. Okay, so our call to action is, today is not just a celebration, although there was lots to celebrate with some fantastic work already going on. It is a beginning. So as we launch the very first National Lived Experience Awareness Day today, we invite every government department, every service, every office, every project and every programme to, number one, promote lived experience in your work and all areas of your work every day. To make lived experience voices a central part of your planning, of your design, of your delivery and of your evaluation of what you are doing. We would like to ask you to build on what's already happening, what you've heard about today or what you might like to try, what you're already doing, how can you improve it even more? Like Fiona said, if we're doing this work, how do we support the people with lived experience who are giving of their time, whether they're being paid like our lived experience group in this particular piece of work, or whether they're volunteering. Maybe you can support them in other capacity building ways. Look at those opportunities. And please just make sure that you're giving every opportunity to embed lived experience in decisions and leadership and learning. We've seen today what that looks like in, sorry to bring you up again, Mr. Michael Ryan, but in what it looks like if somebody gets a chance with that experience to lead change across services. So finally, and I mean finally, looking ahead, next year when we celebrate the Lived Experience Day during Ireland's presidency of the European Union, and with the Public-Patient Partnership, and hopefully events across the country that we can all work together on to create, to again promote and recognise and celebrate lived experience in all its forms. Let's try from today, carry the energy in this room and hopefully on the web stream at home. Let's carry that energy and commitment forward. Let's make lived experience not just something that we recognise once a year, not just something that we celebrate once a year, but something that shapes how we work every day. Thank you so much for being part of this beginning. Let's continue to listen, learn and lead in collaboration with lived experience perspectives and expertise. Gura míle maith.